One. Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to the Cancer Conquering Community. And we're all gathered here today, and we have a really nice group of people who've just shared a little bit about their journeys. But we're here for our special guest, Dr. Gary Phillips from Southern California. And, I've known Dr. Gary for several years, and I'll let him do the intro to this. But Dr. Gary is our resident nutrition expert, and he is really phenomenal. He's given me a number of different great nutrition tips. So get your questions ready for him. And I'm going to hand it over to Dr. Gary right now. Welcome back, Dr. Gary.
Mhm.
Please introduce yourself and let's get going with this great conversation about nutrition and get your questions ready as well.
Thank you, Mark. It's an absolute
Mhm.
honor and pleasure to be here. Can you all hear me okay? So I have the privilege of, first of all, what an amazing community that I encountered when I met Mark at his daughter's wedding. Um, my daughter, the brunette, I don't know if you can see that. That is
Mm-hmm.
my family. My wife,
Oh, wow.
dermatology nurse practitioner, two daughters, Nikki, the brunette, who's a licensed clinical social worker in Boston, and friends with Tawny, Mark's daughter. And Chantel, our eldest, is a tech manager and lifestyle coach. Uh, Incredible. And then there's me. A few years ago, was it a few years ago, Mark, that we met at your daughter's wedding and immediately connected? And Mark was telling me about the community that he set up. I was just so inspired that someone was taking a platform like this to share experiences and things that have gone well and not well with all y'all incredible cancer survivors, cancer conquerors, servant leaders, and amazing people that are on this call. So um, it was an honor, and thank you, Mark, for welcoming me into the community and also uh, interviewing me in two-part series. I am, first of all, hello, Lillian, Melody, Tim, Lehia, John, Jamie,
Mm.
Amanda, Joni, Steve, Nancy, Michael, Kimber, and her father. Thank you. Georges.
Mm.
Is it Georges? um, so what I would like to do today is I'm going to give you a little disclaimer. I'm going to talk about um, functional health approach, natural remedies to common chemotherapy adverse symptoms. Um, just about myself, just really quickly, because I don't want to take too much time on me, but I am a 32-year survivor of a rare blood disorder known as chronic refractory immune variant idiopathic thrombocytopenic purpura. So in English, what that means is a uh, a viral mediated immunosuppressed, I mean, it's an autoimmune condition that affects children under one, pregnant women, adult females, and I was an adult male diagnosed in 1993. I had a virus. I didn't know it. I got kicked in karate. I was purple. My wife and I were in healthcare. I've been a nurse and in healthcare for 47 years. My 18th birthday, well, when I was in high school, I became a licensed vocational nurse because I wanted to help people and I wanted to help people that were hurting. And that began an incredible career that I'll tell you about in a moment. This condition basically uh, in response to a viral bronchitis or influenza A, it ramps up an immune system and it starts rapidly destroying platelets. Platelets are the little cells that stop bleeding. And in the last 32 years, I've had now 88 emergency room visits, steroid rescues for a life-threatening low platelet count that has almost taken my life. but survived. The way this is treated is with high dose steroids, which I've been on for 32 years, but now weekly treatment that keeps my platelet count up. But either way, it's a very serious condition, and I've survived, praise God. My background is a registered nurse, a retired um, uh, physical medicine, chiropractic, family and sports medicine physician. And I also have been a professor of nutrition, University of Phoenix, the largest private university in the country, educating undergraduates on nutrition and wellness. And then also, uh, because I worked with Kaiser on electric medical record informatics, I also taught that at University of Phoenix. But my main interest with all of the people that I've interacted with, and it's been many hundreds of thousands of millions of people from all over the world, I've had the blessing to educate because of my own experience with keeping your nutritional uh, status as high as possible to improve immunity, mind health, gut health, energy, vitality, and cancer prevention, and serious degenerative changes prevention, if possible. So this experience that I'm bringing you today comes from 47 years in healthcare, um, and my knowledge training experience therein, as well as a little bit of artificial intelligence. Um, so I'm going to first take a little survey, and then I'll read a disclaimer, and then we'll get going. Um, I'm going to ask you about some symptoms. You can just thumbs up, let me know if you've experienced any of these symptoms, because we know, and you are all amazing, inspirational survivors of catastrophic illness. And as you know, chemotherapy is incredibly challenging. It has a whole host of side effects, which sometimes are worse than the actual disease. I've experienced that personally. Pharmacologic agents um, have their own side effects for treating the side effects of the disease. And a lot of people, and I'm sure yourselves are at the top of that list, seek alternative, plant-based, organic, natural alternatives or remedies to some of these symptoms. So, with a show of thumbs up or finger up, how many have experienced either chemotherapy related or non-chemotherapy related nausea and vomiting? Nausea and vomiting, okay. How about fatigue or weakness? How about mouth sores from chemotherapy? How about appetite loss, anorexia? Yeah, I know. Amanda and me, we're on the same page. Dry skin and irritation, constipation. I'm putting my thumbs up to all these. Immune support concerns. Okay, so I first want to just read you a quick disclaimer. I know that we're time constrained, but I'm going to do my very best. And anything that I either bring up that you haven't had a chance to ask a question about, or if you want to have an answer to that I didn't ask, I put my email in the chat. So first of all, the recommendations, I'm just going to read this because this is the right thing to do in a professional realm. The recommendations that I'm going to be giving you today are not intended to diagnose or treat any medical condition. Many have not been investigated by the FDA, are intended to educate and inform you. And each individual, all of you, are encouraged to discuss and decide to use any of these recommendations after first discussing the information with your primary treating healthcare provider, significant others, friends, family, professional colleagues. Also, if you have a known food allergy to any of the items in this document or in the information I'm sharing, it'll be surmised that you'll avoid taking those items, obviously. If you develop any unusual reaction after ingesting any of these foods, consider that an allergic reaction and take steps to mitigate. Please report these to your physician for guidance and counsel and or applicable treatment, including but not limited to particular foodstuff avoidance. You are the CEO of your own health. And actually, I brought my whole regimen with me today, so I'm going to sort of bring up the products that I use on a daily basis and why. So I want to focus on the symptom of nausea and vomiting right now. Um, Nausea and vomiting um, is extremely common. And some of the natural remedies, of course, for those of you that have been hospitalized or had medical-based nausea management, you'll hear of Zofran, ondansetron, um, medicinally. Now, Zofran, which I've had many times to combat nausea that's pharmacologic or drug-related or treatment-related, um, it does work sometimes. It also causes constipation, ondansetron, Zofran. So some of the natural remedies that I've encountered, ginger, many people know, is probably one of the best. Fresh ginger, ginger powder, ginger tea, less so ginger ale, although the carbonated non-acidic nature of ginger ale is anti-nauseating to stomach acid that can sometimes be high and cause nausea. But ginger is probably one of the best in any form. Peppermint tea or sucking on peppermint candies can provide nausea support and aid in digestion. Chamomile tea has mild sedative properties and can also soothe the stomach and reduce nausea. And then cannabis flower. Um, in the hospital, they'll give you Marinol, which is a cannabis extract that helps to manage nausea that's related to chemotherapy. But cannabis flower is a known anti-nausea. It's plant-based, it's natural. I haven't seen too many side effects other than increased appetite, mood elevation, um, overall improved health, and great management of chemo-induced nausea. And we have any questions about nausea? Vomiting, very important. When you're vomiting, and I'm bringing up the information about uh, the importance of potassium replacement after vomiting or diarrhea. Vomiting gets rid of a lot of electrolytes, especially potassium. And potassium deficiency due to nausea or vomiting, I'm sorry, vomiting or diarrhea can affect the heart. It can literally stop the heart. So potassium is in a very delicate balance between 3.5 and 5.5 milligrams per deciliter. But when you're vomiting or having diarrhea, you need to replace the potassium. A lot of people think Gatorade is the best replacement. I'm going to tell you that one of the best potassium replacements, besides potassium chloride, which they'll give you in the hospital in an IV, is coconut water. Has high potassium and is very hydrating. Um, the fruits and vegetables that are high in potassium, bananas, oranges, cantaloupe, apricots, prunes are the main fruits. Um, Spinach, sweet potatoes, broccoli, squash, starchy foods like potatoes, although potatoes are not my friend because for those of us who have chronic degenerative osteoarthritis, like I do, from all the steroids over the years. Potatoes is in the nightshades family. Potatoes, tomatoes, peppers that inflame joints. So that along with gluten are to be avoided for anyone with arthritis. Um, Other foods like beans, lentils, yogurt, nuts, and seeds are also a good source of potassium. Um, Again, if you're in the hospital, they're going to give you an IV. So it's really important to hydrate. And the nice thing about coconut water, I have not heard of many people that are allergic to coconut water. I'm a fanatic for coconut. The coconut oil is fantastic. Oil that's used in so many things. I'll talk about MCT wellness product that Gundry recommends about improving energy. I'll talk about that in a minute. But just with potassium, I wanted you to know that one of the best sources is orange juice, broccoli, and coconut water. With regard to fatigue and wellness, a weakness. Um, Now I know that So what I did is I added some of my favorites as far as energy and on this topic. I know that ginseng has been studied extensively and has great fatigue reducing effect and energetic effects to improve energy levels in chemotherapy patients. But ginseng has a side effect that it could cause elevations in blood pressure, and you have to be careful with um, it's a very potent root. So Siberian Panax ginseng is very energetic and it should be used with caution. There are some other things that I'm going to recommend for energy that we'll talk about right now. So um, they talk about ashwagandha, which is a known adaptogen. Um, I'm going to tell you what an adaptogen is. An adaptogen is a natural substance, often an herb or plant extract that's believed to help the body adapt to stress and exert a normalizing effect on body processes and physiology. Adaptogens stimulate your own body's ability to heal, be well, and boost immunity. And I'll talk about one of the adaptogens that are in one of the products. So ashwagandha helps support the body's response to stress. It's an anti-stress. They sell it at Costco, ashwagandha. It's a calming effect. It reduces fatigue that's associated with chemotherapy. You can get it at Costco or on Amazon. My personal favorite is uh, Dr. Gundry, Stephen Gundry, I'm sure you've heard of. Gundry MD is his website. He is a cardiothoracic surgeon that probably the most intelligent nutritional medicine human being on the planet that I've encountered. Um, he has many products. I'm going to talk about a few of them, but as a cardiothoracic surgeon, um, for many, many years, and then becoming a nutritional guru, basically healing himself of obesity, diabetes, and everything else. He has done probably the most extensive research on gut health, mind health, energy, vitality, mushrooms. I mean, so many things. One of his products is called MCT Wellness, and medium chain triglycerides, MCTs, which are in high concentration in um, berries, grape seeds, um, coconut oil. What they are, medium chain triglycerides, are 8 or 10 carbon healthy fats like coconut oil um, that immediately break down into ketones. Ketones are the energy fuel source for the mitochondria in our body. The mitochondria in our body are energy powerhouses that produce ATP for energy. All cells have mitochondria. Mitochondria are responsible for giving us the energy to open our eyes, move every muscle, and for everything that we do energetically. Um, Typically, mitochondria are fed by the breakdown of sugars that we eat, glucose, and through a special process, they produce ATP energy from glucose. That's the main energy source. However, the most efficient energy source for mitochondria for cellular energy or whole body energy, mind health, gut health, physiologic health, immunology is ketones. Ketones are specifically beta hydroxybutyrate, which is the ketone that's broken down from medium chain triglycerides or those items that are high in that. They break down in our body. They're produced, um, they're broken down in the liver. And when ketones enter the cell, they are the fuel for providing energy and also for replicating the mitochondria. So this was found out that you've all heard of the keto diets, putting yourself in a ketogenic state, which is extremely uncomfortable by eating low protein, high healthy fat foodstuffs to produce high ketones or put you in a ketoacidotic state, which is not good. Uh, Creates alcohol breath. Diabetics have been pulled over for when they've been in a diabetic keto state from all the ketones, from all the fat that they're burning because they didn't take their insulin. Very complex, but the bottom line is ketones. You don't have to have a diet, a ketogenic diet, to break down ketones or make ketones available for energy. What I mean is that Dr. Gundry found that you can ingest um, the components in here, like berries, polyphenols, which are plant-based antioxidants. So there's black currant, red currant extract, um, all high in medium chain triglycerides, red grape extract. So a teaspoon of powder a day, a powder a day in this much water, okay? Whatever, 16 ounces, 8 ounces, creates incredible energy, not caffeine related, and just creates vitality for all your cells. I've been taking this for years. I have not found anything better. They do make MCT oil that you can get at Costco. That MCT oil is basically uh, from coconut oil. It breaks down, you put it in your coffee. There's coffee creamer called Bulletproof that actually has MCT oil in as well. And you should all involve and include MCT oil or MCT powder in your nutritional regimen every day if you want energy and gut health. Um, the other thing that I recommend is uh, a greens drink every day for fatigue. This is all on the subject of energy, vitality, and combating fatigue. So a greens drink that I found, and many companies have this, but the one that I found that's probably the most heavily endorsed and uh, best is called AG1. AG1, drinkag1.com. I have no affiliation with these websites, no affiliation whatsoever. However, AG1 is a blend of 75 vitamins, minerals, probiotics, which I'll talk about, and whole food sourced ingredients and adaptogens, which help stimulate your own body's physiology, uh, gluten-free, dairy-free, egg and peanut-free, lactose-free, uh, herbicidal-free, vegetarian, vegan, paleo, keto. Um, and it basically, it's like having all the fruits and vegetables and all their high polyphenol antioxidants. So plant-based antioxidants that all the nutritional experts talk about at improving health and reducing oxidative cellular damage and stress are called polyphenols. Polyphenols are plant-based antioxidants contained in all the greens, all the reds, all the blues. So these are heart healthy, um, reducing aging, reducing stress, cancer preventing. One of the most famous um, antioxidants is vitamin C, and I'm going to talk about that in a second. But AG1, it's a little packet I take every day, and it's amazing. I highly recommend it to have a greens drink in your life. Um, the other thing is D3 is vitamin D3, which is um, I think cholecalciferol. Uh, it comes in little gel caps. It's essential for immunity and bone health. I don't believe there's any side effects. I recommend um, 5,000 micrograms a day, which is 125 micrograms. I mean, 5,000 IUs. And there's also um, what I was going to tell you about AG1 is they also have a vitamin K2 D3 dropper to supplement. I have this, which I bought online, that's D3 and K2, that supports bone and immune health. It's gluten-free. These are little capsules that I take every day, um, that promote immunity. And vitamin K2, if you don't know, is called menaquinone. It's essential for blood clotting, which is important for me. Um, but if you have a tendency to form clots, you have to be careful about anything that promotes blood clotting, as well as some conditions that actually promote blood clotting. But for me, I welcome blood clotting components that stimulate that. Bone health and cardiovascular function are also improved by vitamin K and are primarily found in animal products and fermented foods. So, the other thing I want to talk about is um, mouth sores. The symptom of mouth sores, very hard to combat because a lot of the chemotherapy causes mucositis, which is very painful mouth sores because of the immune suppressive effects. Um, some of the things that people have used are aloe vera gel as a topical treatment to soothe mouth sores, licorice root. When diluted in mouth rinse, licorice root can help reduce inflammation. Um, Licorice root has to be taken with caution because it causes hypertension and high blood pressure. So if you're Greek and you like drinking ouzo, which is a licorice-based liqueur, or you take licorice of any form and you have hypertension, not a good combo, don't do that. But as far as mucous membrane health, I want to tell you about vitamin C. Um, this is also immune stimulating. I take vitamin C every day. And the important sources of vitamin C and why vitamin C is so important. Nutritionally, obviously oranges are high in vitamin C, ascorbic acid. Vitamin C is very heavily researched, but when you take it in pill form, um, most of it ends up in the toilet. I'm going to tell you about the effects of vitamin C, but the most important thing with vitamin C, which is so immune boosting, it's a number one antioxidant. It helps to maintain uh, cardiovascular health, all of your connective tissues, muscles, bones, joints, vessels, ligaments, tendons, brain tissue, everything that's connective tissue, which is the glue of our body, is um, made healthier with vitamin C. Um, in humans, we do not produce our own vitamin C. So therefore, it has to be supplemented through diet, through high vitamin C nutrition, oranges, acerola cherries, blueberries, um, all the citrus fruits. Um, and there are some tropical fruits that have incredibly high vitamin C content. So in your diet, um, if you're having good nutrition and high doses of vitamin C, there's no reason, I mean, nutritional vitamin C, organic. I would recommend supplementing, if you do want to supplement, with something called ester vitamin C. It's made by American Health. Um, I wanted to tell you that vitamin C is not produced in humans, so we have to supplement it. Um, Long ago, the FDA or the RDA, the recommended daily allowance to prevent scurvy in sailors many, many years ago was 60 milligrams of vitamin C a day. Horribly insufficient. Dogs and animals produce 4 to 6,000 milligrams of vitamin C a day. Dogs and animals very rarely get cancer, very rarely have hypertension, very rarely have vascular severe illnesses. Largely, and now they have, joint problems and they do get cancer, but principally the high, and they're very physiologically strong. Imagine animals, that can eat everything off the floor and not die. If we were to do that, we would die. But vitamin C in the American diet has to be in the right form. So ester vitamin C or nutritional organic vitamin C is 100% absorbed. These are actually gel caps that have gentle non-acidic ester vitamin C, which is it's the way it's chemically formulated from citrus bioflavonoids. Um, there's also the citrus bioflavonoids are the polyphenol antioxidant portions of oranges. So sweet orange, tangerine, lime, lemon, acerola, rutin, hesperidin complex, and naturally occurring vitamin C metabolites in an ester C formulation are in this particular supplement called Ester C by American Health. Get it on Amazon. Um, it's incredibly uh, helpful to all tissue healing. I wanted to talk about,
Excuse me, Dr. Gary.
yes,
James has a couple of questions. He asked,
go ahead.
what foods, if any, help reduce chronic inflammation?
Mm,
And then his second
great
question
segue.
is, any suggestion for body muscle pain from having hypothyroidism?
Hey, James, excellent questions. Uh, Let me talk about uh, anti-inflammation first. Um, Anti-inflammatories medicinally have so many side effects. The non-steroidal anti-inflammatories, the anti-inflammatories that they give for rheumatoid arthritis and all those things. They have so many side effects. I have personally, because of 32 years of steroids, high dose steroids, my body connective tissue has been demineralized. It's been weakened, bony fractures, disc injuries. Discs are made up of fibrocartilage, which is made up of connective tissue, which vitamin C promotes the healing of. Um, the joints have broken down. I've had severe hip and knee arthritis, meniscus tears and meniscus degeneration, knee replacements. All of that, the anti-inflammatories that I have found to be the best, I would have to say, is turmeric. Turmeric is an Indian spice that is probably the most beneficial anti-cancer, anti-inflammatory, anti-immune boosting um, powder cooking. Um, Turmeric it can be taken in medicinal form. I mean, supplement form. Um, if you cook with turmeric, turmeric has to be absorbed into the body with a few conditions. Turmeric, like if you use it in cooking, first of all, you need heat to best absorb turmeric, like in cooking. You need a healthy fat like avocado oil or coconut oil, a healthy fat that helps the absorption of turmeric, and also ginger root. And also, no, I'm saying if you were to like mix up a concoction, which I used to do, of honey, turmeric, ginger powder, lemon juice, you would have to add black pepper, which is called bioprine, or you can go to Costco or online and get the quinol 1500 milligram in 2 capsules supplements. You can take 3,000 to 6,000 milligrams of turmeric a day, whether in cooking or in that format, and you will have potent anti-inflammation with little to no side effects. Um, and I highly recommend it both for cancer prevention, anti-inflammation, and joint health. The other one that is my favorite that I've been taking for many years is something called Heal and Soothe by Living Well. It's on Amazon. It has in it all of the uh, most anti-inflaming natural herbal plant-based components that I have found. Principally, um, enzymes, enzymes that metabolize gluten, which is a huge source of inflammation for a joint. So for the proteolytic enzymes, uh, enzymes for protease, alkaline protease, bromelain, and papain, those are all enzyme blends that reduce inflammatory agents, specifically gluten in the body, which actually coats joints and causes a propensity for daily inflammation in joints. The other thing that this has, and it's been heavily researched, is Boswellia serrata extract. Boswellia is a plant-based anti-inflammatory, extremely potent. Orange bioflavonoid complex, vitamin C, main anti-inflammatory. Ester vitamin C, organically taken vitamin C, one of the best anti-inflammatories. Nutritionally and supplementally, these are your best bets against inflammation. Or yucca root. Yucca is uh, people have heard of yucca. That root is very anti-inflammatory. This also has turmeric root in it. This also has something called rutin and alpha lipoic acid in it as well. Alpha lipoic acid is an anti-neuritis. It's for typically neuritis that people get um, from diabetes or other forms of neuritis or neuropathy. My father-in-law used to take alpha lipoic acid by itself every day for his nerve-related hand pain from diabetic neuropathy. He was diabetic. As far as your other question, James, about um, low thyroid related muscle, um, I don't know anything that combats, hormone related muscle pain. There's a lot of causes of muscle pain that really can't be treated or that are difficult because they're from either overstrain or from chemicals in, some of the things that we're taking. So I don't have an answer to that. Hopefully that
I
helped.
I, I think he asked something about hypothyroidism.
Yes, that's what I was
Yeah.
just talking about. I, I don't
Okay.
I don't have an answer for that particular part of the
Yeah.
question.
Mm-hmm.
The other thing that I wanted to talk about is the constipation that can come from um, uh, anything, from uh, typically pain relievers for pain, narcotics, anything from chemotherapy, any chemical source of constipation or lack of nutritional. I think it's incredibly important for what I'm going to talk about right now, real quickly. Um, First of all, whatever the source of constipation, um, the best thing is to have enough water. Okay, so water, clean water, is about 1 ounce per kilogram per day that's recommended. So for a 100 kilogram person like me, that's 100 ounces of water, like 6 bottles. Like I think they're 19-ounce bottles of water. You can do the math, but um, the question sometimes is, is alkaline water just as good? Alkaline water, you have to be careful. It should be in equal ratios with regular water, purified water. Um, you don't want to alkaline. Alkaline physiology is good. Let me explain that. In our body, we have a neutral pH. We have a pH balance. The acidity in our blood, it needs to be 7.4. If your blood is too acid or acidic, this is associated with disease. In in all circles of physiology, when disease enters the body, it creates a very lowered pH acidic environment just by the nature of the disease. A lot of cells turning over, a lot of acid producing bacteria and horrible things that break down the body. So in general, an alkalizing physiology or a physiology that is a little bit on the higher end between 7.4 and 7.8 pH is beneficial. And how do you get an alkalizing physiology? By a large vegetable content, greens drinks, vegetables are alkalizing. So when you bring a lot of vegetables, healthy vegetables, spinach, kale, um, greens, asparagus, all of the good Brussels sprouts, broccoli, all of those vegetables are healthy because not only do they have high polyphenol content, high antioxidant, high fiber, but they also create a anti-cancer, anti-disease, and a healthy immune boosting physiology. So a plant-based diet with healthy protein is ideal for fighting cancer, for preventing cancer, for creating gut health, for providing your body the ability to eliminate waste. So water, very important. Greens drink, very important. Um, and then if you have to take uh, anti-constipation medication, the best are high fiber, something called Senecot. Some people have heard of Senecot, senna leaves. Senecot is a natural fiber laxative that is beneficial for combating acute constipation, along with water, along with fleshy fruits and vegetables, along with yogurt, Greek yogurt or otherwise. Um, Yogurt is extremely important as a probiotic with live active cultures. I'm going to talk about my favorite is actually Sigi's yogurt that they have at Whole Foods. It's coconut, plant-based coconut blend, non-dairy, has 11 grams of protein, low sugar, live active probiotic cultures. I would encourage, if you're not allergic, to have yogurt every day like this. Sigi's is plant-based coconut blend. It's a great probiotic. It's something to incorporate as well. Healthy fats like avocado. I have an avocado every day. I have olive oil every day. Olive oil is one of the best high polyphenol, antioxidant, healthy fat, gut health. Um, Dr. Gundry sells an olive oil. Uh, all I want to say about olive oil is that a shot a day can keep the doctor away. Um, and it improves mind health. It improves gut health by providing healthy probiotic into your system and helping just lubricate your gut. And also, the best olive oil blends are those that are from Spain, Italy, or Greece. Dr. Gundry, basically, the density of the polyphenols, which are anti-cancer, immune boosting, all the healthy benefits of this plant-based oil, which is the best, uh, have a different concentration in the different olive oils. First of all, Dr. Gundry says, and he's done the most research on olive oil on the planet, I believe, it has to be in a glass container. So if you use this in cooking, this happens to be extra virgin olive oil, cold extracted, produced by small family-owned farms in Western Crete, Greece. Costco has in bottle, from Tuscany, Italy. You don't want it in a BPA-based plastic because the BPA, which is a polyvinyl component of plastics, can bleed into the olive oil in plastic containers. So BPA free, you see a lot of BPA free bottles and plastics. And also olive oil that you buy, if you're going to cook with it, this is fine. If you want to buy Gundry's, it's $35 versus $8 to $12. But this is 30 times the polyphenol density and 30 times more powerful than a teaspoon. I'm sorry, a teaspoon of this is like 30 ounces of this. So olive oil is extremely beneficial, and I highly recommend it. And however you get that.
Excuse me, Dr.
Uh,
Gary.
yes,
We have some questions that people want to ask. We normally go to 12:15, but
right.
because there's so much demand for you, we're gonna
Yes.
close off at 12:30.
Okay.
So do you
Let me
want to?
step away for just 1 minute and then I'll answer the question, okay? Just
Okay.
for 1 minute.
Okay. So I'll
Thank
I'll
you.
give my commercials then.
Yes, go ahead and give your commercial.
So next week we have Kara Honorato and Brittany Ross, and they're going to be talking about, along with myself and Lihia, they're going to be talking about childhood cancer. Oh, let me announce the winner of this beautiful pendant uh, that James is offering, and the winner is Lillian Hamilton, and she is the winner of it. So, James, if you can get in touch with Lillian,
Oh, thank
uh,
you so
she
much.
is the winner.
I
Uh,
will wear it. I will post it. I will. Thank you. And thank you so much for that. I really appreciate it.
yeah, you're gonna
Uh,
love it. You're
More than
gonna love
happy to. Just one thing I wanted to point out, let's see if we can get in, is I have two types. Basically, I have the men's cross, but for women, I have that. It's an oval with our logo on
Love
that.
it. I love it. Normally I have my cross on and I couldn't find it today. So that's
It's entirely your choice, and particularly for breast cancer, these also come in rose gold. So if you go to my website, luxspeed.org, I put it in the chat. You can just go to the website, see which ones you want. I also have them in crystal. So you make your choice, just let me know, and it's en route.
thank you so much.
Happy to. Happy to.
That's
and
wonderful.
and let me say that Lillian made a great effort to invite people and and she brought in I think 5 or 6 new members to the group in a day. So congratulations, Lillian, you did a great job.
Thank you. I'm glad to be here. And
Yeah, we're glad to
it's
have you, and
a
thank
pleasure
you
to
to
meet all of
everyone for joining us here. And let's get to the questions for Dr. Gary. So, just raise show of hands, how many people have questions for Dr. Gary? Okay, let's go to Lillian. I know Amanda had a question.
And then I want
Uh,
to mention probiotics and mushrooms before I get off the air to everybody.
okay,
So let me answer the questions right now because I know this is a very huge topic and I want to help you. Lillian,
Yes. Um, Question on I research a lot of this stuff as well. Have you ever heard of Gary Brecka?
no.
No, okay. So he recommends a lot of this as well, but he says that we should get tested for like a genetic test to see if we're absorbing like the nutrients that we're taking because sometimes you have an absorption problem.
Hmm.
So I just wanted to get your thoughts on that and also this new like methylene blue that I keep hearing kind of as a preventative. I don't want a reoccurrence. I want to kind of try to get off the I'm NED, but they still have me taking a pill for like a stage 4 for like 7 years. But I worry about taking it for too long because I do have side effects from it. I would
Yes.
my quality of life back a little bit.
I resonate with what you're saying. I'm also on a lifelong medication that has side effects, but promotes, platelets. Um, but as far as absorption, let's talk about that first. Absorption of all nutrients happens in your small intestine, and it happens after the stomach has churned up the food. The enzymes from the pancreas have broken down carbohydrates, fats, and proteins into smallest microscopic molecules that are absorbed by our small intestines. So there's two things. One is if it's a plant-based, natural, organic, um, easily assimilable component that you're taking in, like ester vitamin C or orange juice or whatever it is, some food, that's going to break down and be absorbed in the way the body does it best without any problem. Okay. As long as you don't have a pancreas problem, an exogenic pancreas problem where you're not pouring enzymes into your small intestine to break down the food so it can be absorbed. In the absence of that, you will absorb 100% of those things that are natural and organic and get into your system. As far as testing absorption, that's just really a blood test, because if something is absorbed, it's going to be on a lab report. It's going to be on a lab test.
Right.
The problem I have with people who want to test for absorption that I've seen is they're typically trying to sell something, and they're typically trying to sell things that you're deficient in based upon a blood test. I have my reservations. I've been in healthcare for 47 years. I've seen everything. And I really, in my private practice and in my professional professorship, I always sort of just talked about factual, what blood tests show and what nutrition brings into your body.
Okay.
So I have my reservations on testing for absorption. That being said, as far as methylene blue goes, I have only heard little things about that. It sounds very toxic, but I've heard that there's also people that do YouTube videos that think that this is the fountain of youth. So I would be very careful with anything that has a methylene in their word, because benzenes and methylenes, and these are very toxic chemicals to the body. They're not produced by the body. When they're introduced to the body, there's severe reaction.
Wow. Okay.
And that reaction can either be positive or catastrophically negative. So
Okay.
I would say stick to plant-based approaches. Send me an email. Ask me some more specific questions.
Okay.
But I really feel strongly about just having a very rich, high polyphenol, healthy fat, healthy protein, healthy greens, healthy sources of vitamin C and oils, and plant-based components to make you and put you in a state of preventing cancer, mitigating cancer, or managing cancer. Does that make sense?
Yes. Thank you.
One
The
thing I want to talk about, go ahead,
hydrogen water, quick thoughts on that?
on hydrogen water. I've
Or
never
is
heard of.
there just regular purified water is okay?
So water is H2O. It's two hydrogens and an oxygen. I don't know what hydrogen water is. Hydrogen is in water.
Right.
Um, Hydrogen also can fuel a vehicle. It's very expensive. But alkaline water, which you may be thinking about, uh, as I said before, it could be used in moderation. Alkaline physiology from vegetables and high plant-based uh, um, and vegetable food sources is the best way to alkalize your body. And an alkaline physiology in general, from all experts worldwide, is a healing physiology. So whatever you can do to slightly elevate the alkalizing, your alkaline pH between a very narrow range of 7.4 to 7.8, which Lillian, if anybody's going to ask, if look at absorption or test your blood and talk about nutrition, I would say put someone on a plant-based, healthy, alkalizing diet, or not diet, nutritional regimen, and then test their pH or do a blood gas to test their pH after a series of time. That would be the number one way to see if your nutritional regimen is promoting an alkalizing physiology, which is anti-cancer, anti-disease, and is a preferred physiology.
My oncologist, they will never test for this like I've asked to have I've gotten my vitamin D tested finally, but they don't test for levels of like vitamin D or anything.
They do test for vitamin D. There is a vitamin test
That's
for vitamin D.
one that I've ever gotten.
What's that?
That's the only test that I've ever gotten is a vitamin D, and that's because I had to ask for it over and over.
Right. So whenever there's an investigation into bone health, fractures, or immunity, uh, a lot of times calcium, magnesium, and vitamin D, glad you brought that up. I like you have to have a nutritional healthy source of calcium. Calcium is in broccoli, it's in milk products, it's in cheeses. Um, Calcium is very important, but not excessive. But dietary, nutritional calcium, extremely important for bone health, even more important for people that are on medications that deplete calcium or deplete minerals from your bone, like steroids for 32 years, like me, that causes weakness and fractures, like me. So for 32 years, I have taken high levels of nutritional calcium, magnesium, and vitamin D. Magnesium is excellent for bone health and immunity, as well as vitamin D3, 5,000 international units. This is actually a supplement that's made by Nature's Truth. It has absorbable, highly absorbable calcium. What I was talking about before that I didn't finish is when I was in practice, I used to see undigested vitamins in people's colons on X-ray when I was X-raying their lumbar spine. Uh, and I'd said, "What did you have for breakfast?" Well, I had my vitamins, I had my eggs and bacon. And I said, I know you had vitamins because here's your X-ray. Undigested vitamins. Do you know that we have the healthiest toilets in the world because of the multi-trillion-dollar vitamin supplement industry? Do you know that when I was in practice, I invariably 80% of the lumbar spine X-rays had undigested vitamins. So I had to counsel people that why are you feeding your toilet? So you want to have absorbable, 100% absorbable vitamin C, either nutritionally through your diet, calcium, magnesium, and vitamin D in the right ratio. It has to be in a 1-to-4 ratio. Vitamin D3, its own immune boosting characteristics, incredibly important for bone health, incredibly important for immunity, personally and professionally. That make
Excuse
sense?
me, Dr. Gary. I'm going to step in here.
Go ahead.
We're going to shut off the recording now. So thank you,
Okay.
everyone, for joining us here at Cancer Conquering Community.
Thank
And
you.
we'll continue afterwards here.
Thank you.